Hello, my name is Alfredo Vasquez, and I will be your nursing recruiter over for Metropolitan State Hospital in California. Metropolitan State Hospital services forensic patients who are on different various holds. There are mentally disordered offenders that have already committed a crime and are pretty much writing their sentence out so they can be done with whatever crime they had committed and continue their lives. We also have PC 1370s, which are in competent stand trial. These offenders haven't committed any violent crimes, so you won't see anybody that are murderers or attempted murders. And the introduction to this facility, it was built in 1921, and it was an insane asylum at the time. It housed the criminally insane just in year 2000, so it's fairly new for 10 years. If you want to work for an environment that is nurse friendly, this is a perfect place to work. Especially if you're fresh out of nursing school, you're able to get as much overtime as possible. There's lots of incentives for career mobility as an RN. You could become a health service specialist, which entails of doing assessments and checking up on the RNs to make sure their temporary conditions are up to par, their admission assessments are up to par, and you're not an actual team on the floor. So it does have its incentives as well if you're not interested in working directly on the floor with the patients. Also, you're part of an interdisciplinary team. You have a psychologist, a psychiatrist, social workers, rehab therapist, and this whole team is designed to help with the patient's rehabilitation to go back to court and face his charges. You have court competency groups that you'll be conducting, which has various different material considering the pleas that they're able to be represented in court, the court personnel. Um, You'll also be conducting symptom management groups, which entail like how to manage schizophrenia, bipolar, if someone has auditory or visual hallucinations. Um, uh, these can be very detrimental in a hospital because they will tend to start, acting out, either being a danger to themselves or a danger to others. So there's different trainings that you're able to go through, like as far as what the hospital offers, and you have a very good security system here at the hospital as well. In case you were ever like in jeopardy of being hurt, you have a Wi-Fi personal duress alarm, which is notified through like the administration where they keep track of all the movement of their employees. If that alarm were to be set off, everybody would know exactly where this position you would be at, your last name, everything pops up on the screen, and you'd have immediate response there in a matter of seconds. And also, part of like the movement is kept tracked by the hospital police officers. They're very professional, like on what they do. They handle all the custodial aspects of the job. In case you need to go like to out sent to a clinic, they're there to help escort you. They put the patients in shackles. They have certain protocols that we have to follow when we do like an admission. The nurse normally goes back to the hospital, but like for instance, if LACUSC were to admit a patient, then the nurse was able he's not necessary, so they go back to the hospital and the hospital police stays with them while they receive the treatment. If they're not admitted and it was just a random appointment, you're there to like collaborate with the medical team over at the hospital to make sure that everything is being relayed the proper channels. This is a perfect job for people that are looking to maybe possibly looking into corrections or any other types of avenues, because there's lateral transfers that you can do based on your interest. For instance, they have Kalinga State Hospital, which is, you have 5 different state hospitals to choose from. Up in the valleys, up north, there's plenty of prison systems that you can apply directly, and the salary is very competitive, and it would be a lot easier for you to pay off your student loan. you you actually have to make sure that you're able to work with this type of population, because this population could be a very dangerous it could pose a very dangerous threat to any individual. So as far as being aware of your surroundings is the utmost importance. You have to be able to have good proxemics of the patients when you're approaching them. You have to have good eye contact, kind of like check out what type of affect that they have for the day. If they're feeling very paranoid or guarded, you probably want to give them a little more space. If you have a patient that's a little more receptive and you're able to, like, maybe open up, the approach is everything. If a patient is giving you antecedents of like wanting to like harm himself or harm others, you have to be aware of what can take place. I've seen incidents where like things can happen in just a heartbeat, and you really have to be on your toes. Somebody can get seriously hurt if they're not aware of their surroundings. I've seen it happen way too many times. Staff members have actually died at this particular facility, but it's been years, like over 10 years since anything like that has ever happened, and the measures that have taken place here have worked out tremendously. As far as you need to, as for the clinical skills, you're not going to be practicing as much here. That's the only down part. You won't be able to like do IVs and catheters on a daily basis. They do have a skilled nursing facility where you're working directly with patients that are greatly disabled and they need assistance in a lot of their activities of daily living. In that aspect, you will be practicing your nursing skills. But overall, you really like need to know your psychotropic medications, the basic medical conditions that you'll see at the hospital. Probably you wouldn't see like on a med-surg unit. This type of population, you really have to like work along with the doctor and to formulate different types of foci that the medical conditions fall under. You have to do your nursing care plan interventions, temporary conditions, any change of status. Part of the admission process, you have to do a physical assessment. You orient the patient to the unit. You provide them with any type of referrals they were requesting for. And also, you really have to excuse me, make sure that these individuals like receive the proper care. Like if they have any type of symptoms of trouble breathing, you have to attend to that. We have a crash cart that is there with a defibrillator, and you are responsible like to perform any type of life recessive measures. And the good thing about like the responses around here is once you call like a certain number in the administrative building, they will automatically contact the proper authorities. You have paramedics, and the fire truck will get here in a matter of seconds. In any type of situation where you feel like you're not able to handle, and the hospital, like medical doctor, is not able to respond as quickly as you would like, you can send them out automatically. And it's a very good way of covering everybody's best interest, the patient's best interest. You want to make sure your license is covered. There are plenty of benefits working for Metro. The only thing is you really have to just be able to adapt to this type of care. It's not for everybody. There are a lot of nurses that have tried this, and within the next couple months, they just walked away because it was just too much for them to handle. It's a completely different environment. You're not able to just respond to a patient that has a call light button. You don't do a lot of like, there's not a lot of wiping and different various backbreaking methods that you're normally used to at a normal hospital setting. So those are like the benefits for a lot of other people that would be interested in doing some different type of work as opposed to just being on a regular med-surg unit.